We're going to talk about the assessment for the health psychology SSC today. We're going to be looking at the written part, which involves applying psychological theory to a patient interview. We're going to look through all the different aspects of it and give you some tips and hints about how to actually carry the process through. Okay, so we want you to, first of all, look at a patient interview. Patient interview is online. I'll give you a little bit of information about what that was. And then we want to really think about how you can apply psychological theory to an understanding of this patient. What is it that you, as a medic and as somebody who is now aware of biological, psychological, and sociological perspectives, what somebody like you, how would you think about this patient and how would you look to treat this patient? We want the process to involve the integration of at least two models. Now, there are various things that you could look at. I'm going to give a little bit of suggestion as to what I would do in this instance and how you would compare and contrast those models. Okay, so what is this piece of work that you've been asked to do? It's an analytical essay. So it's you being asked to use the same essay writing skills that you've used in the past. That involves references, that involves the same standard of evidence, and it involves analysis of the literature as it's appropriate. It's also, however, looking for you to kind of apply this to this patient, to this real type of patient. It's a recording of an actor, but it's a real type of scenario. How can you actually take the theory and apply it to what you see in this context of this video? We want you to think about the different needs the patient has, how that relates to the context that they're in, socioeconomically, psychologically, physically, and think about their health outcomes as well. What this isn't is it's not a summary of the video. We're not looking for you to describe what happened in the video. It's not a reflective diary, although you can use reflective language. We're not looking for you to reflect on precisely what you felt while you're going through this process. You can reflect on how your understanding of psychological theory might affect how you work with this patient, but we're not looking for you to reflect specifically on your own internal experience. It's also not a list of diagnosis or symptoms. We're not looking for you to provide any sort of medical diagnosis. We know what the diagnosis is for this patient already. You're not describing the patient, you're explaining what's going on for the patient. That's really what it is that we're looking for. Okay, so the data that you're working with. Your source is a patient interview that you can find on YouTube. This is the link to it. The link will also be available in the PowerPoint slides themselves, and the link will also be a live link on the Moodle page as well. You can access that fairly straightforward. What I want you to do, first of all, is have a look at that video, understand what you see there, understand what's going on. It's a video of a clinical encounter. Again, it's imaginary, but it shows you how it would go. This is the imaginary referral letter. So the person interviewing the patient in this situation, yes, happens to be me, but imagine that it's not me. Imagine that it's another clinician who have got this referral letter in. Dear team, thank you for agreeing to see Leah at your service. She's a 43-year-old female who's recently had surgery to remove cancer tissue from her breast. We would like you to assess her for any further intervention she may require. So this is a patient who's already had surgery, and they're coming to this clinic. We're not entirely sure what type of clinic it is or what type of service it is, but imagine that you're in the position of the clinician here doing the interviewing, and imagine that you're in or imagine that you're in the room. And this is the patient being assessed to see what type of needs they might still have, what type of issues still might be important for them in terms of looking after their health in the long run. So we want you to think about some different parts of the encounter. We want you to draw upon what is the patient says, any information that the patient gives you. We want you to draw upon how they say it, what the different tone and inclination that they have in their voice, maybe what they leave out, what they don't say. What is it that you would like to know that isn't discussed? What is it that the patient maybe skirts around and doesn't want to talk about? And then any kind of contextual clues that they mention, anything that they talk about that might suggest what their living situation is like and what the plus points and the negative points might be about that situation. The core thing that you're being asked to do is to assess the patient's needs. So first of all, what I would do would be to use a biopsychosocial model. Looking at biological needs, looking at their psychological needs and their sociological needs. And then assess the same patient using a medical model. So the biopsychosocial and the medical model are the two models that I would suggest you would use to contrast. If you're interested in another area, that's okay as well, but these would be the obvious two to use. And then the fourth part would be to compare and contrast what each model reveals and also what each model misses. This is about your understanding of what's going on and what these models tell us, not right answers. We're not necessarily looking for specific things that would be 100% right or wrong answers. So the first model, as I've said, would be the biopsychosocial approach. This asks what's happening to this person across these three different domains and how do these interact. The interaction is very important. As I've said before, stress and the stress response is the conduit, is the bridge between physical health and psychological health. And stress is often also the bridge between the sociological and the biological. So you should organize your analysis under these three headings in this instance. You should think about the biological factors, think about the psychological, and think about the social. What would the biological factors be? This might be what you're most familiar with up until this point in your medical career. You're thinking about the physical health condition that she talks about and any other conditions that she mentions. You might be thinking about any pain that you might want to assess, that you might want to think about. You might want to think about fatigue and how that might affect the patient. You also might want to think about any disability, thinking about aspects of having tissue removed and how that affects the patient disability wise. You may also want to think about medication and treatment burden. Would you like to know more about this patient's medication? Is she on the right medication? Is she on any medication at all? Should she be on something? Is there any questions that you would like to consider in here? Also thinking about the patient's age. Is there any relevance to where they are at in their life, age and stage wise, that might make them more or less vulnerable to risk in an ongoing time frame? About comorbidities. Is there anything else that they would have, and any physiological stress as a result of the comorbidities or because of the cancer issue itself? The key question really is, how does the patient's body constrain and shape their experience? It's the physicality side that we're interested in here. We'd also be interested in the psychological. We'll be thinking about their mood, their emotions. Emotions, again, remember, are one word. Negative emotions can have a big impact upon somebody's well-being. Would this be something that you'd like to assess? Would it be something that you would like to discuss more with them? Is it something that you would like to refer on to others? You'd like to know about the patient's coping style and coping strategies. Do you see any signs of avoidance? Do you see any signs of them not wanting to pay attention to various parts of their life? We're interested in their beliefs about illness. We're interested to know if you could tell us anything about the way that beliefs affect people's illness and illness perception and perception of themselves when they have experienced an illness. We want you to think about the person's sense of control. Do they feel as if they have control over their life? How important is control? How important is something like hope or hopelessness in relation to their general mental health, but also in relation to whether they would attend follow-up classes, follow-up services, whether they would be willing to do screening tests in the future regularly. Also, their emotional response to diagnosis and treatment. What can you tell us about the way that people experience a diagnosis? What can you tell us about the way that people hide their emotional responses to a diagnosis and treatment? What can you tell us about the way that patients interact with a doctor? What that might tell us about their experiences of treatment. The key question here is, how does the patient understand and emotionally respond to their situation? What is their internal experience of it? Their thoughts and their feelings. And also, what is their behavioral responses to it? What are the behavioral patterns that they are getting into or are in already? And then the social is the way that they interact with the human world around them. What's their family and caregiving responsibilities like, or care receiving responsibilities as well? Are there those who they need to look after, who they see as being more important than themselves? Are there those who are not in their life, who it might be important for them to maybe find people to fill those roles? What's their work situation like? What are the benefits to the situation that they're in? What are the drawbacks, and how might that impact upon their health in the long run? How might their financial and housing situation and socioeconomic status impact upon their health? What would we like to know here? What do we know? Are there any blanks that need to be filled in? Is there anything that we should be thinking about offering the patient in the long term to making sure that they can deal with these issues? Do they have any social support, or are they isolated? Are they somebody who is not linked in to their community well? Are they a person who is well connected, who floats around without any real social connection? Are there expectations on them that would be impacting upon their health? Are there things that would be expected of somebody in their situation that maybe makes them more likely or less likely to, say, provide care to others, or more likely or less likely to go out to work? Are there any other cultural factors that we should be thinking about? Do they have access to healthcare? Do they have good access to communication, education services, and such things? The key question here really is, how does the patient's social world help or hinder their health? So pulling this whole model together. So at this stage with the essay, you should be able to answer these questions. What are the key needs of this patient? What are the factors that are protective, that help them to deal with their ongoing health concern and health problems? Are there any factors that are harmful? Any pitfalls, any weaknesses that could make it more difficult for them to deal with their situation? How do biological, psychological, and social factors interact? What are the ways in which these three areas can impact upon each other? Remember, this is a formulation, it's not a checklist, so we're looking for this to be a written discursive piece of work, not a checklist. Second model that we're going to look at is to examine the patient from a purely medical model. This model focuses more on disease and pathology. It focuses on diagnosis and treatment. The core assumption here is that illness is primarily a biological problem to be identified and fixed. This is maybe more the type of way of thinking that you're used to, and then maybe something that you're more comfortable with. Now, what we'd like you to do here, first of all, is to look at what is the primary medical problem. What symptoms might be most clinically relevant? What are the clinical symptoms for this patient that you would be wanting to think about that they would have experienced and or moving on? I would want you to think about, in general, for a patient like this, should there be any investigations or treatments prioritized in the long term or in the medium term? What are the type of symptoms and disease issues that we would be interested in at this point, looking at for this patient? And then thinking about what outcomes matter most in this model. Thinking also to yourself, what falls outside the frame of the medical model? What doesn't it include? Now, the medical model does some things very well, and we'd be looking for these things within your use of the medical model here. Medical model gives clear diagnostic pathways. We're looking for a discussion of the type of diagnostic pathways a patient might have gone through already in this type of situation. Looking for evidence-based treatment decisions and risk stratification, showing your awareness of the use of the evidence base in order to provide acute management for acute treatment management for the patient. We're looking here to show that yes, the medical model is strong, it is powerful, and it does provide us a good insight into aspects of the patient's life, but it is limited. Now, all of this is well and good. One of the things that we're really interested in is the comparing of the two models. We're really looking for you to provide insight as to what each model highlights, and then also what each model ignores and doesn't include. We'd also be thinking about how each shapes an understanding of the patient's needs. Ask yourself these couple of questions. Does the medical model fully capture the patient's experience? I would argue that it doesn't. But there are things that it does capture. And also then, does the biopsychosocial model add clinically relevant insight? We're not looking here to say that the medical model should be completely disregarded. What we're saying is that the medical model should be expanded, maybe even incorporated into the biopsychosocial. So integrating of the models is probably the thing that we're looking for in the end. Strong essay does not treat these models as enemies. A poor understanding of psychological care would be to say that psychological care is better than medical care. A poor understanding of psychological care would be to say that psychologically therapeutic treatment, say for mental illness, is the only way to go, and that medical interventions are not useful. That would be a wrong understanding. The problem I often find with practitioners is that they come from either a biological, a psychological, or a sociological perspective. And the problem is that depending on which perspective they come from, they're only focused on the problems that are associated with their area. Biologically trained people are only interested in are sometimes only interested in the biological. Psychologically trained people are only interested in the psychological. And sociologically trained people, public health practitioners, social policy practitioners, social services might only be interested in the social side, and they see in each of these instances, the people can see the problem as being solely, say, a psychological. The treatment is solely psychological, and the outcome is solely psychological. Or the problem is solely biological. The treatment is solely biological, and the outcome is sociobiological. Or the same with sociological. Each leaves out the other two components. So what we're looking for here is for you to show that you understand how the models complement each other. Explain why the psychological and the social matter in medical care, and link it into a situation like this, a clinic like this, where we're thinking about real-world clinical practice. This is about becoming a better doctor, absolutely not about rejecting medicine. What we're looking for in your writing: clear use of psychological theory. You can look to the reading list and the other reading materials that are on Moodle as a place for you to find an understanding of psychological theory. We're also looking for you to draw on evidence from the patient interview. Tell us what the patient says. Tell us what that indicates. We're looking for a structured, logical argument. You're going to be giving us throughout an argument that builds upon understanding this patient. We're not just looking for description. We're looking for a comparison. We're looking for judgment, and we're looking for clinical insight to be shown. Think, if you were caring for this patient, how would this understanding that you've got through this module change your approach and show us that you've understood that and you know how to think about health in this way? Some final bits of advice: I would think about using headings. They can help you to structure an essay. Make sure that you talk about theory, but anchor it in specific examples from this video, thinking about this patient. Avoid vague statements. Any truth claim that you make should be backed up by evidence. So if you say depression is more common in people suffering from cancer, or a big problem suffering for those people, or a big problem for those people suffering from cancer, we would want evidence for that. We also want you to be explicit about why these models matter, why conceptualizing health in these ways is important, and why to think about them in one way or the other. If you can explain the patient better at the end of this module than you would have been able to do it at the beginning, then you're doing it right and you're in the right space. Okay, hopefully that's useful. If you have any problems, just email me, and I'm happy to do a Zoom call or a Teams meeting or whatever and see if we can help to take things forward. Okay, thanks.